Hello, just a quick follow-up to this week's lecture since we didn't get through all the material. So the other topic for today, this week, was hygiene care, okay, and care of and prevention of decubitus ulcers. So again, a pressure ulcer is something that people are very, very susceptible to, particularly if they have difficulties with mobility, if they are incontinent because of the moisture on the skin all the time. Okay, um, if they're at the end stage of life, they can also be at further risk. So it's something that we always want to be looking for, assessing for, and supporting care that's going to reduce the risk of a pressure ulcer. Okay. So regardless of a person's level of risk, they should always receive preventative care. Okay, and so thinking about a decubitus ulcer is going to occur at many of the different pressure points in the body. So somewhere where we have a bony protrusion on the body is going to be more susceptible to having a pressure ulcer. Okay? And these are just a few examples of the areas that are more at risk. Okay? Like we suggested, you're going to stage a pressure ulcer, okay, and depending on what they look like when you find them. Okay, staging is really classifying the degree of tissue destruction. It's not going to then describe that healing process. So once we stage a pressure ulcer, it's going to remain at that stage, regardless of the healing that takes place. Okay. So when we look at classification and staging, there's 4 different stages. Okay. So when we look at a stage 1, okay, we're looking at intact skin with non-blanchable redness. So this means when you press on the skin, it does not become pale when pressed on. Okay, it's the early signs that there's becoming skin breakdown. So the idea here is we would need to get pressure off that area. We would need to reposition and practice repositioning that client every 2 hours. Okay. Sometimes you'll see that there'll be a MeFix bandage that's ordered to prevent friction and further breakdown at that site. But any sort of dressing or that would need to be ordered by a physician. So as soon as you identify a stage 1, so a non-blanchable localized redness in an area, you're going to want to notify that physician. Stage 2, again, is now more skin loss. Okay, you're going to have an open, a shallow open ulcer, or sometimes what you might actually see is that there is a serum-filled blister on top of the skin. So if there's a blister or it's ruptured, that would classify it as a stage 2. Okay, you're not going to see your adipose tissue, okay, and your deeper tissues at this point are not visible. For stage 3 is full thickness tissue loss. Okay, you may have some subcutaneous fat that's visible, but you're not going to see things like the bones, the tendons, and the muscle. Okay, they're not going to be exposed at this point. You may see a little bit of tunneling occur at stage 3, but you will likely and definitely see tunneling of the wound in a stage 4. Okay, and so the difference here now is that you may see muscle, tendon, ligament, and bone within that pressure ulcer. Okay. And then there's unstageable, which is really where you can't determine the degree of tissue loss, that it's obscured. You can't see it. Okay, so you need to be able to differentiate between the different stages because you need to be able to look at a wound and classify it within the appropriate stage. Okay. When we look at the Braden scale, it's really the types of things that are going to contribute to the development of a pressure ulcer. So it's really predicting risk for pressure ulcers. And so it looks at all 6 of the different areas. Okay, so when we think of sensory perception, we're looking at the perception of pain or pressure. Can they feel pain? Can they feel pressure or soreness when they've been sitting in the same position for a significant length of time? Moisture. The presence and duration of moisture on the skin is going to reduce its resistance to physical factors such as pressure. Okay, and so people who are incontinent, who are sweating a lot, are going to have more moisture on the skin and be more at risk for skin breakdown. When we think of activity, okay, we're thinking about, is that client dependent or immobilized? And they're going to be more at risk if they cannot get up and move around themselves. Okay. So are they think about, are they confined to bed and chair? Do they walk on their own? Okay, because the risk is going to change based on that. And then when we think of mobility, think about their ability to change and control their position. So can they move themselves in bed? If they're confined to bed, are they able to at least change positions by themselves in bed, roll onto their side, shift around in the bed, or do you have to do all of that turning for them? Okay. The more confined to their own position that they're going to be, the greater risk of skin breakdown and that pressure in a particular area. In terms of nutrition, we're thinking about poor nutrition is going to lead to more skin breakdown. We know that wound healing requires protein in order to heal quicker. Okay, so what are their eating habits like? Do they complete their entire meal? Do they complete some of it? Or do they eat none of it at all? Okay, thinking about that is going to be impact the healing process and the integrity of skin. The last thing is friction and shearing. So this is really how much assistance do they need to move. Do they move by sliding their body, or are they picking those arms up and moving them and then placing them down? So when we're moving them and pulling them along, say the blankets or the bed, that adds a level of friction and shear that can cause skin breakdown. So the rating scale is something that you're going to assess your patient against, and it will give you a score between 6 and 23 in terms of what their risk for pressure ulcers are. Okay, patients that score 14 or below are going to be at high risk for pressure ulcers. So this really just gives us a consistent and reliable way to compare assessments of a patient over time. So if we think about hygiene practices, okay, I just want you to realize that no two people think about hygiene or perform hygiene practices in the same way. Things like social practices, body image, their personal preferences, even their culture and their values and beliefs that they hold are going to influence the types of hygiene practices that they do. So don't think and walk into the room thinking that just because you do your hygiene practices in a particular order, or you do something in the morning as opposed to in the evening, that everyone else will do it in the exact same way. It's important to consider this and ask the patient about the factors that are going to impact their hygiene practices. Okay. Think about what you think could be barriers to giving good hygiene care, how you would deal with some of these barriers, and what are some of the opportunities that as a nurse providing hygiene care does. Okay. For nursing, hygiene care is not just to get the client clean. Yes, that happens in the process, but there's a lot of opportunities for us to do other routine assessments and nursing care as we provide that hygiene care. In addition, it provides an opportunity for us to connect therapeutically with that client. Okay, so it's never routine. We can assess physical limitations, we can look at health promotion practices and needs of the client, and we can attend to some of their emotional needs while we're providing that type of care. Okay. It's an opportunity to spend time with the client, to listen to them, to do your head-to-toe assessment, to look at their range of motion and mobility. And many times you may actually pair hygiene care with doing things like addressing change. Okay. You must be very well organized to perform hygiene care. You want to make sure when you go in to perform it, you have all the supplies that you need, that you have the time available to spend with that patient. Things that you need to think about would be unmanaged pain. That would impact a person's ability to do their own hygiene care, but also to want to have it done to them as well. Okay, thinking about being cold and how you would cover a person during hygiene care. Okay, people might feel vulnerable or exposed. We all generally tend to do our own hygiene care and don't rely on others. So when we do require the help of another, we can feel embarrassed or that loss of control. So just consider that as something important, but it's not just this routine care of cleaning someone. It's really important skill though, because it can impact client comfort, dignity, and even healing. Okay. It's an opportunity to be looking for things like pressure ulcers, okay, and impaired skin integrity. It's a time to think about looking at different treatments, medical complications, and it can increase the length of stay if we do not provide good hygiene care. So just a few things for you to consider. Always provide privacy. Shut the door, pull the curtain. Don't just take all the clothes off the patient at once, okay? Maintain safety. Okay, so whether you have the bed rails up, the bed is in the lowest position. Those types of things are really important to maintain safety of the client. Maintain warmth, right? So only take off the clothing in the area that you're cleaning, and then you can dry that area and put it back on. Always promote independence. When a person goes home, you're not going to be there to do their hygiene care for them. So you need to help them get back to being independent again. So that may mean setting them up and letting them do some of their own hygiene care themselves. And then you come and you help with those areas that perhaps they can't reach adequately, such as their back or their feet. Okay? But we want to promote independence so that they can eventually be doing their own hygiene care. And think about their needs, right? What are they going to need while you're doing it? Is it an opportunity to do a dressing while you do hygiene care? So do you need to bring those types of supplies with you as well? So just to kind of think about Mrs. Beauchamp again in relation to this. So the same type of information that you already know about her is on the left. Just a few extra things would be that she has no deficit in terms of hearing or speech. She does wear glasses, okay? She is alert and oriented. She has no memory deficits, okay? She is a moderate assist ×1 with dressing and toileting. She's independent with her upper body activities of daily living is what ADL means, grooming and feeding. In terms of mobility, she's a partial weight bearing on left lower extremity and assistance ×2 with the standing walker, right? So in terms of getting her dressed and performing her hygiene care, she's going to need some moderate assistance with just one person. If you're going to be getting her up and into the shower though, and out of bed like that, to get her up to the standard walker, you're going to need to get another nurse to help you with that. Okay. So those are a few things to consider. Here's just a couple more critical reflective questions to see how you can apply the content from this week. What more would you need to know about this patient to be able to provide adequate hygiene care? So think about that for a minute, maybe pause the video and work through that question yourself, okay? What are the specific nursing considerations given what you know about this patient? And what aspects of the patient's medical history might impact her hygiene practices? So pause it here, and then I'll give you a few things that I was thinking about. So when you're thinking about hygiene care, you always want to think about mobility status. Okay, is she an assist? Does she do it by herself? Can she get up and walk to the sink to do her teeth herself, or does she do it at the bedside? Mobility is really important because it'll determine whether or not you need to be beside her the whole time or how independent she's going to be. You need to think about what are her preferences for hygiene. Does she do it all in the morning? Does she like to do her hair and shower and things like that at night? Because that will impact the type of care that you provide at a given time in the day. If she has pain, you may need to give adequate pain medication prior to beginning your hygiene care. So that would be another consideration. Okay. Thinking about range of motion exercises will impact things like, can she reach her back and her shoulders? Can she reach and bend over and touch her toes to clean her feet? Okay. Other things to think about, particularly with Mrs. Beauchamp, is she is a little bit overweight. So I think about, does she have skin folds that we need to make sure we're cleaning and drying adequately to prevent infection? Okay. So those would be another thing to really be looking for and inspecting on the skin, lifting up the skin folds, lifting up the breasts even and looking underneath them and making sure that we're adequately cleaning in those areas. Okay. In terms of diabetes and foot care, that has a whole section in the textbook that you really should be aware of and have a read about in terms of the type of care that we recommend for diabetic foot care. Okay. The other thing is really to consider that she wears glasses. So for her to be able to see, even to clean herself, she will need to probably have her glasses on. So making sure that those are at the side of the bed and within reach is going to be really important for her care. A couple more questions. She tells you that she's a modest person and does not wish to have any help with her hygiene care. What would you do? Think about that for a minute. And can supporting Mrs. Beauchamp in her hygiene practices be delegated to another care provider? And if so, which ones? And why might the nurse not delegate this care to another member of the healthcare team? So take a minute and think about those. What I would want you to think about is that she does require, a person requires hygiene care, particularly if they have a catheter. We need to be washing that catheter and that area where the catheter enters into the urinary meatus a number of times a day. So, at those times we have to speak to the client about the importance of that hygiene care. Okay. If we're seeing skin breakdown and sweat, we need to talk to the client about the impacts of not performing that care. And that is really, how we would work with them to collaboratively find a way to make them feel comfortable in you supporting them with that care. And yes, hygiene care can be delegated to a practical nurse, or it could be delegated to a PSW. And you know what? Many times we will work together as a team to identify the clients that one healthcare provider may take the lead on in terms of hygiene care. But there's many times that us as a registered nurse would also provide hygiene care as well. And, we may not delegate that care if there is issues with skin breakdown and we want to be looking at the skin carefully. Or maybe we're going to do a wound dressing at the same time, and we want to be there to observe because we think there's maybe signs of infection. That would be something that then we may not delegate to another member of the healthcare team. Okay, so during hygiene care, you notice the following on Mrs. Beauchamp's coccyx. Okay, the top right thing. What is that? What stage is it? Okay. And what is the nursing role when she notes this assessment finding? What position and techniques can be used to reduce the risk for additional skin breakdown? And how frequently should the nurse support Mrs. Beauchamp to change positions to reduce the risk for skin breakdown? So pause and answer these questions, and then you can continue. So that is a pressure ulcer. I would stage that as about a stage 2. It's a partial thickness with exposed dermis. Okay. What is the nurse's role? Absolutely. We're going to get that pressure off. That's off that area. That's the first thing we want to do. We're going to want to notify physician as well. Okay. And we're going to want to document about this assessment finding. Okay. So in terms of positioning, okay, we want it to elevate the head of the bed to 30 degrees or less to decrease the risk for the patient. Okay. Although research doesn't have really conclusive evidence in how often we should be repositioning, really the best practice and what we suggest is repositioning that client every 2 hours and not putting pressure on the area where we've seen the skin breakdown. The 30-degree lateral side lying position is the best position to prevent positioning over bony prominences. So that would be one that we would be looking at. Okay. And always think about repositioning applies even when they're up in the chair. Okay. With patients that have the ability to shift the weight in their body, they should be encouraged to do that every 15 minutes when they're sitting up. Okay. The other thing we can think about are foam, gel, or air cushions that can also be used to help distribute weight. So repositioning every 2 hours, that 30-degree side lateral lying position is going to help with that. And the last slide for Mrs. Beauchamp. What is activity tolerance, and how does the nurse assess this in Mrs. Beauchamp? What are the hazards of immobility that Mrs. Beauchamp may be exposed to if we don't support her to mobilize? And how does the nurse protect themselves from injury during patient care? So activity tolerance is really the amount of activity that Mrs. Beauchamp can tolerate. So is she able to get up and walk twice or 3 times a day, even from bed to the door of her room? Or is she able to get up and walk around the unit a little bit? The amount of activity that she can tolerate is going to be what we consider her activity tolerance. And this is really important because we don't want to push her too hard, but we do want to challenge her to be up and moving because it's going to reduce her risk for skin breakdown and many of the different health challenges that are associated with immobility. Okay. There's lots of different hazards of immobility and it affects all of the different systems within the body. So I'm going to let you go and look that one up within the textbooks and the readings, even for week 2 and 3. Okay. And how does the nurse protect themselves from injury during patient care? So thinking about a wide base of support, bending the knees, using the large muscle groups to lift. Never, ever lift or move someone on your own when you know that they're a 2-person transfer. That is the best way to hurt yourself. You always need to make sure that you just find another nurse to help you if you are worried at all that the patient cannot hold their own weight. And we'll get into a little bit more about that as the weeks continue. So that is this week's content. I do have a couple multiple choice questions that I can go through with you again. This skin condition is characterized by thick, silvery, scaly, inflamed patches of skin. Psoriasis is the answer. A fungal lesion that appears on the sole of the foot is known as a plantar's wart. Which nursing action is most beneficial to prevent fungal infections in hospitalized clients? The answer is B, dry all skin folds thoroughly. Which of the following are correct for care of the eyes, nose, and ears? Select all that apply. So with this one, there will be more than one correct answer, and you should expect questions like this on your tests. Those would be the correct answers that you should be selecting. Last one. Which of the following are expected findings during a patient's bath? Again, select all that apply. And that is the answer there that you should be selecting. Great. I hope you have a good week, guys.